Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will return to the X-ray and scanning facilities of Sutter Buttes Imaging in Yuba City as we observe a fantastic new technique that allows a patient to check to see if their bodies are showing signs of the common problem called osteoporosis. The bone loss problem of osteoporosis affects millions of Americans and causes crippling deformities and changes to the spine. For the first time, the Yuba Sutter area now has a state-of-the-art device that allows for the quick and painless early detection of osteoporosis and could lead patients toward the prevention of this troublesome condition. In the pharmacy corner tonight, our award-winning neighborhood pharmacist, Bob Church, will expand this topic of osteoporosis as he gives us the latest information on calcium supplements that might be helpful to decrease the risk of osteoporosis. Are there safe ways to maintain calcium in our bodies and help prevent bone loss? Well, we'll learn the answer to this question and others about calcium supplements in tonight's Pharmacy Corner. This evening's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a look at the latest medical news. A new Danish study has found drinking a daily dollop of wine can cut the risk of some kinds of stroke. The research is the result of a 16-year study of 13,000 men and women. Their health was followed for 16 years. When researchers looked at the data for a variety of alcoholic drinks, those who drank seemed to have no fewer strokes than those who did not. But when they examined statistics for those who drank wine, results showed that those who said they drank about 1 to 6 glasses per week had a 34% lower risk of stroke than those who never or hardly ever drank wine. Those who said they had wine daily had a 32% reduction in risk. The most popular theories are that there is something in the wine that has a protective effect, that the pattern of drinking wine generally is different from that of beer or other alcoholic beverages. Most people drink wine slowly with a meal. And those who drink wine, at least in the United States, tend to have other beneficial habits. They often tend to be better educated, they tend to smoke less, and they exercise more. There are two primary types of strokes. The most common, ischemic, is caused by a blood clot that blocks blood flow to the brain. Less common is hemorrhagic, or stroke caused by bleeding into the brain. Alcohol can prevent clotting, so researchers note that alcohol may be associated with a lower risk of ischemic strokes, but could have the opposite effect on the risk of bleeding or hemorrhagic strokes. Researchers are looking at the effect of alcohol in part because of the so-called French paradox, in which there's a low incidence of cardiovascular disease in the French population. This is true despite the fact that the French diet is high in fat and other risk factors. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in the Pharmacy Corner is our award-winning registered pharmacist, Bob Church, from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you. It's nice to be here.
Always a pleasure.
Thank you.
What's the role of calcium in our bodies?
Well, as most people know, the role of calcium, and I think the one that most people would identify with would be the strength and integrity of our bones, and that's certainly one of the biggest uses of calcium in our body. In fact, 99% of the calcium is stored in our bones. But calcium is also instrumental in things such as nerve impulse transmission, muscle contraction, proper release of hormones and neurotransmitters in our body. It plays a role in blood pressure. It plays a role in blood clotting. So there's a lot of various roles for calcium in our body other than just strength and integrity of our bones.
Tremendous amount of chemical reactions that need that calcium present.
Absolutely.
Why has there been such an increased interest in calcium supplements in the last decade?
I think because there's been a tremendous increase in amount of awareness about osteoporosis, which is probably the largest metabolic bone disease affecting primarily women after menopause, but men also of upper ages. Tremendous amount of press about that, and so I think people are becoming very aware that calcium plays a role in preventing osteoporosis.
We know it's important for adults to have adequate calcium, but what about calcium in, let's say, an adolescent, a teenager?
Okay, there have been in the last 10 years quite a lot of studies, most of these generated in Japan, that have taken adolescents and subjected them to calcium supplementation starting at an early age, around the age of 13, 14 years of age. And they found that the bone mineral density increases with adequate intake of calcium supplements. And they also found that when you eliminate the calcium supplements, that the bone density starts to dissipate. So I think the thinking is now that if you start taking an adequate amount of calcium in your adolescent years and continue it through life, you have the ability to have the highest bone density peaking that is possible, instead of waiting until your later years to start the calcium supplements.
So maximizing that calcium in the bone so that when something does go wrong later, you're more protected.
That's right.
Interesting.
Yeah.
Are there differences in the many calcium products on the market?
Yeah, there really are, and I think the calcium product that most people are familiar with is calcium carbonate. It does provide
Is that like Tums?
Yes.
Okay.
And it does provide the largest amount of elemental calcium per tablet, and that's really what you're looking at, and people have to read the label and determine not just how much calcium carbonate is in each tablet, but how much elemental calcium in there. It's about 40% is really how it plays out. Another one, calcium citrate, is important for people who do not have as much stomach acid to help digest, or people who are on drugs like Prevacid, Prilosec, Tagamet, Axid, Zantac, those drugs that decrease acid content. They will get a better response from calcium citrate than they will calcium carbonate.
Are these products pretty safe?
Yes, they are safe if they're used properly, if they're used in the doses that they should be used at, roughly 1,500 milligrams a day. If they're used in stronger doses, you run the risk of kidney stones, kidney damage. Those are the two big ones, so it's important that people know what the dose is and take it accordingly.
What about mixing with other medications? Can that be a problem?
Mm-hmm. It can. Calcium can inhibit the absorption of certain antibiotics, certain blood pressure medications, iron products. And calcium itself can be inhibited by certain drugs. Equestran comes to mind, and there are others. So it's important that people communicate with their physician or pharmacist about the medicines they're taking when they're going to start taking calcium, so that they have a clear understanding of how to take their calcium.
As you're talking about this, it brought to mind something that even happened to me when I was a medical student. I would carry Tums around in my pocket because I was stressed at a time period, and would take this almost all day like candy. And one day had a kidney stone that threw me on the floor, and I couldn't move for about 3 hours with horrible pain. So these things are not just benign agents. They really can cause a problem. I've never taken a Tums since that day, and there's many other medicines you can use to help stomach acid now, which work 1,000 times better.
Absolutely. Yes.
So how do you advise your customers about the proper role of taking calcium?
What I like people to do is, initially when they're going to start taking calcium, they need to either talk to their physician or their pharmacist. Get a clear understanding of what medications they're going to be taking along with the calcium. Know that the calcium should be taken with food because the absorption's better. It slows down the transmittal of the calcium, so it has more time to be absorbed. They need to take it in divided doses so that it doesn't cause as much GI upset, plus you also get a better blood level in divided doses. You need to be aware of any drug interactions. I think those are the important things that people need to know. They're not going to get in a lot of trouble with this drug as long as they just put a little thought into it and get a little information before they start it. And the potential for benefit is great.
Good. And they don't always have to take the expensive stomach acid things. And
Definitely not.
Okay, great. Well, I know that's a different subject of stomach acid, but they do use those things for that purpose,
That's right.
too. Bob, as usual, that was very useful information, and I hope that our viewers will discuss their questions about calcium with their doctors and pharmacists before they undertake a lot of these treatments. Thanks again.
You're welcome. Thank you.
We look forward to you coming back to the Pharmacy Corner on future programs. Now, on with the Medical Explorer. Let's continue our exploration on the condition of osteoporosis as we leave our Medical Explorer studio here at the Advanced Skin and Allergy Medical Group and walk a half a block down Shasta Street to Sutter Butte's Imaging. Well, it's certainly a pleasure to be back here at Sutter Butte's Imaging. Our special guest tonight is Dr. Susan Lott. Dr. Lott, thank you for having us come over.
Oh, welcome.
Thank you. I almost welcomed myself today. I don't have to do that. I really enjoy coming to Sutter Butte's Imaging because you always have state-of-the-art technology here. We've looked at your MR scanner. We've looked at your breast mammography testing. We've looked at your ultrasound and different things like that. But today we're going to focus on the subject of osteoporosis. But before we get to that, I'd like you to tell our viewers about your educational background, and you actually grew up in Yuba City.
Yes, I did. I was raised in Yuba City, and I attended public schools here. Went to Yuba City High School, and I went to Mills College, which is in the Bay Area Women's College. Went to medical school at University of Southern California, and did my radiology residency at UC Davis, which is radiology residency is a 4-year program, and then I also did a 1-year abdominal imaging fellowship down at UCLA before joining the group up here.
That's quite a few years. You think of college and medical school, and then the 4 years of residency after medical school, and then that extra 1 year, so it's quite a few years.
Yes, it is.
And it's interesting, too, you actually followed a family member into this field. Is that right?
Yeah, my father's a radiologist, and we practice together.
What's that like, practicing with your father?
Well, it's working out well so far.
He doesn't come by and tell you what to do all day?
No, it's kind of mutual.
Okay, very, very good. Well, the subject, osteoporosis, it really is something that can affect a lot of people, but let's start at the beginning. Maybe you could tell us exactly what is meant by osteoporosis.
Oh, sure. Osteoporosis is really a weakening or thinning of the bone, which increases the bone fragility and increases susceptibility to fractures.
So an example of, I looked at my grandfather as he was aging, and he seemed to be getting smaller. That was always the joke around the family, saying that I was getting bigger, but I had stopped growing, and he was still getting smaller.
The shrinking person, kind of.
Shrinking.
Yeah.
What actually is happening there in the bone? What's going
Actually,
on?
vertebral fractures. The spine actually gets weaker quicker than other bones in the body, and so people can develop compression fractures and actually lose height, like you're talking about. Actually, the majority of spine fractures are asymptomatic, so a lot of times people don't even notice increased pain when they are having these vertebral fractures.
I was thinking about that. He never complained of back pain or problems. I must have, in my work every day, more back pain than he ever complained about. So that you just sort of get almost like a squishing down of the vertebrae.
Exactly.
Could you perhaps show us on your diagram back there a little about that?
Well, this is just a diagram we keep in the office that illustrates the architecture of normal bone, which is a trabecular-like structure here. And as stated, normal bone is very dense and strong, and it can withstand everyday stresses and strains. This is an example of an osteoporotic bone, which you can see it's much more porous and fragile. And this diagram shows the thoracic kyphosis, or hump, that is associated with osteoporosis and osteoporosis-related fractures.
So as you see people starting to bend over, that hunchback look of their back is what you mean by as the bone sort of softens, they do that.
Right, and actually measuring the height of your patients is a good screening mechanism too, because a lot of these people are asymptomatic.
Maybe again you could compare the normal spine in the diagram to one that's not normal.
Okay, so this is a close-up of the normal spine. These are the intervertebral disc, and these are the vertebral bodies, and they're stacked up in a column. And then this is a diagram of the osteoporotic spine with compression fractures, and these are the vertebral bodies, and you can see how they're compressed, how there's significant decrease in height of this vertebral body compared to this. And these are the disc right here.
Interesting.
So you get this wedging, a typical wedge contour, which accounts for that curvature of the spine.
What really can be done, though, to prevent this from happening? And why can't we do more things early on so that people don't have to have this happening to them?
Well, that's, I think, why there is a renewed interest in osteoporosis at this time. I think we know a lot more about the disease now than we used to, and we now view osteoporosis as a preventable and treatable disease. Also, there are new medications on the market, and there's more research being done to existing medications such as estrogens. And then lastly, there's improved technology for diagnosing osteoporosis. So I think all these factors contribute to a renewed interest in the disease process.
Now, other than someone becoming hunched over or shorter, what really can happen to interfere with their life? I mean, it's not just a cosmetic concern.
Exactly. Well, the consequences of osteoporosis are fractures, and it can include any bone in the body. We typically think of the spine, hip, ankle, wrist. Those are the most common fractures. But hip fractures have the greatest overall consequence. They affect the patient physically, socially, emotionally, financially. For a lot of people, once they sustain a hip fracture, it marks the transition from independent living to dependent living. A lot of these people end up in a nursing home. And in fact, only a third of patients who sustain hip fractures ever achieve their pre-fracture level of function. So it can be very devastating.
Even with all the modern orthopedic surgeries and those things.
Exactly. And also, as patients age, there's a higher mortality associated with hip fractures.
I was thinking about that, the high risk of people actually getting severe illnesses and dying when they fracture their hip. And so with the tests we're going to talk about in a few moments, you can see that happening, the changes happening before that may happen to the patient.
Exactly. One thing also I'd like to mention is that with this new technology and the new testing that we're going to discuss, the DEXA scanner, we're fortunate in the sense that Medicare and a lot of insurance companies are seeing the need for this sort of testing and are reimbursing or paying for the examinations because they see that it really is helpful as a preventative measure because they do want to work towards that goal of preventing hip fractures and other osteoporotic fractures.
Now, before Sutter Butte's Imaging acquired this fantastic new device, how would doctors look for osteoporosis on testing? How would it show up?
Well, in the old days, it used to be once a patient had a fragility fracture, and that's really too late for any sort of prevention, oftentimes too late for much benefit from treatment.
Would it show up on an X-ray?
X-rays are not that sensitive for diagnosing it because it depends a lot on the technique on the X-ray. Sometimes if an X-ray is overpenetrated, the bones can look demineralized, but it certainly can suggest possible osteoporosis, and now it can lead to a better test.
Would it show up on MR scans or CAT scans, osteoporosis?
No. Not in general. I should say, when you mention CT, like a standard CT as an incidental finding, no. But CT is one method we use for measuring osteoporosis. I mean, there are several methods, I think, and I can talk a little bit about that if you
like.
like.
Well, why don't we go on to that? Let's say now we had someone, well, you should tell me, what ages should someone consider coming in to be screened?
Well, that's a real controversial subject. You talk about screening. The World Health Organization came up with a list of criteria for selective testing. I don't think they are at this time promoting generalized screening, but I think we'll move into that direction because it is such a valuable test. So criteria for selective screening would include women who are considering estrogen replacement therapy but are not convinced at this point to do that. People who are considering alternative therapies, like with the new medications, the biphosphonates, which decrease bone resorption.
Would this be primarily women who are at the menopausal age?
Exactly, yes, menopausal age.
Or have had total hysterectomies that have lost their ovaries?
Right. People who have medical conditions which predispose to osteoporosis, and some of those would include gastrointestinal disorders, anorexia nervosa, alcohol abuse, smoking, being thin is a risk factor. Other medications like steroids is probably the most common that leads to osteoporosis, but heparin and dilantin are also associated with osteoporosis.
Well, I understand that your patient's ready to show us what it's like to go through this scanning technology, so why don't we go over and take a look?
Sure, good idea. This is our DEXA scanner, and we're actually going to watch an exam being performed on a patient. Now, DEXA stands for dual energy absorptiometry, and as you can see, this is a pretty simple examination. It doesn't take very long. The patient can wear their own clothing and lay on the table, and there's an arm that you can see over the head of the table, and this actually has two energy sources which simultaneously will scan over the patient, and the machine will measure the energy absorption between soft tissue and bone, and then yield a bone mineral density.
What's really interesting here is we have the door opened. The technologist is not wearing lead. This must be a very low energy producing device. Why don't you talk a little bit about that aspect?
Actually, the X-ray exposure is very low. It's much lower than a standard chest X-ray. It's actually less radiation exposure than even a flight from San Francisco to New York.
You mean when people are on an airplane, they're actually getting some X-ray exposure?
Oh yeah, there's daily radiation exposure. A lot of people don't realize that. Yeah, so this is actually less than your average daily background radiation exposure. And actually, there's no lead walls. And the only requirement, since the technologist performs these scans, every hour throughout the day, she has to stay 3 feet away from the energy source.
So when someone's considering having this done, the issue of exposure to X-rays and radiation really is a non-issue.
Exactly.
Because no one gets on a flight worrying about X-ray exposure from flying across the country, and there's probably more being exposed there than there is from this.
Exactly. Yeah, that's true.
Great. So the patient generally is just lying there like on a bed and just waiting for this 5-minute test to go through.
Well, actually, we do scan 2 sites. That's the advantage of this machine. It can scan various anatomic sites, and that is important because osteoporosis affects different bones in the body at a different rate. It tends to affect the spine earlier than, say, the hip. And that's one reason we like to do a spine measurement, because it allows us to diagnose early osteoporosis. Spine measurements are also better for following response to treatment. However, if your goal is to reduce hip fractures, it's been shown that fracture prediction is best measured at that particular site. So the bone mineral density calculated in the hip is actually becoming the gold standard. And we routinely measure bone mineral density in both the spine and hip. So it's almost like 2 separate exams. That's our routine.
So she's actually finished already?
She's finished with the spine.
So now you would then have her go to the other position to do the other part? Is that how that would work next?
Yes.
Well, why don't you tell us about what all those numbers mean on the screen?
Okay. This is a frontal view of the spine, and we routinely measure and average the bone mineral densities for L2, 3, and 4. This diagram is not as good as an X-ray, but it gives us at least the morphology of the spine and lets us know if there's any abnormalities which could account for false readings. As people get older, they tend to get degenerative changes in their spine or get collapsed vertebrae, and that increases the density and can give you a less reliable measurement.
And you'd see that on there?
We would see that on there. We could also analyze the numbers. There's a certain trend that the numbers should follow, and if that trend isn't matched, then that would also make us suspicious, and then in that case we may actually even recommend a standard X-ray to try to correlate the two and see what's going on. So basically these are the bone mineral density measurements here, and what we do is we compare them to a normal young adult peak bone mass. And that's how we report these measurements. We compare the bone mineral density to the normal young bone mineral density, and from that calculate a standard deviation, and that standard deviation is expressed as a t-score.
Now, are there actually, next column says percentage. What does that mean there? The last column?
This column is an age match, and this is percent young adult. So we actually go by this one. Percent age matched is in general not that useful because you're comparing to other people with osteoporosis, okay? So this is the most valuable.
So how would you rate those numbers looking at what she has there?
She looks great. L2 through 4, and it's 92% of the young adult.
We want to thank you for volunteering to be our patient today. How did it feel to be on the table during the scan?
It was very comfortable. It's very simple task, very easy.
It only took 5 or 6 minutes.
Yes. It was very comfortable. So not a problem at all for anybody.
Does it make you feel good to know that your bone density is doing pretty well?
Very much so, yes.
Thank you.
Thank you.
Again, I'd like to thank Dr. Lott and the staff of Sutter Butte's Imaging for allowing us to tour behind the scenes of their modern Yuba City facility. If you have questions about osteoporosis and new modern bone scanning techniques that are offered in our area, you should make an appointment to see your personal physician to see if they may be right for your personal medical needs. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology, cosmetic laser surgery, and liposuction office in Yuba City with your suggestions for areas and people that you'd like to see on this program. I'm always interested in hearing from you, and I hope that you'll suggest to your medical doctor or other healthcare professional that you'd like to see them here with me on the Medical Explorer. We are a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me here at the Advanced Skin and Allergy Medical Group of Yuba City at 350 Del Norte Avenue, Yuba City, California, 95991. Or you can check out our webpage with your computer on the World Wide Web. Simply log on to www.bestlasers.com, bestlasers.com, and check us out on the internet. In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City, Marysville, and other Northern California areas. For all of us here at The Medical Explorer, I'm Dr. Robert Peppercorn. Thank you for joining us tonight, and have a great evening.